In terms of specific preparation before the procedure, the most important thing are antiplatelet medications, which are important because they make the blood less sticky and therefore significantly reduce the chance of forming blood clots inside the stent once the stent's been deployed. So for patients that would be aspirin, and clopidogrel has been around for a long time. There are newer agents, tablets such as prasugrel or ticagrelor, which are now being used more frequently. They're slightly more potent than clopidogrel. There are advantages and disadvantages to using more potent agents of this type, but that is something that would need to be considered, especially depending upon how long after the procedure the patient was going to take these medications for, especially if they had other medical problems. Patients would also be expected to take their other cardiac medication, and certainly in my practice I tend not to discontinue those medications prior to the procedure being undertaken, and classically that would be beta blockers, maybe a nitrate if they've got angina, certainly a statin, and possibly an ACE inhibitor or similar tablets if the patient has high blood pressure. And then of course if they have other medical problems, then generally those medications do not interfere with what we're doing or what I would be planning to do in the cath lab. So for example, diabetic medications, other things for sort of chronic conditions, painkillers and so on. By and large, patients can continue those in the run-up to having the procedure performed. At the time of the procedure, because of the fact that we've got tubes inside the circulation, we use heparin, which is also something which makes the blood sort of less sticky or take longer to clot, and that's something which we use in order to during the procedure, and generally the effects of that wear off really quite quickly, and so we would the patient won't really notice what's going on there, but equally if they do have a bleeding tendency, it's important that we identify what's going on. And then following the procedure, the aspirin and clopidogrel or similar tablets would be expected to continue for a year if the patient's had a drug-eluting stent. If they've had what we call a bare metal stent, then they can stop the secondary medication, the clopidogrel or so on, after a month. And we would then, or I would then hope that once the patient has had an angioplasty, hopefully their symptoms have improved, then a number of medications can then be reviewed. Certainly nitrates, because I would hope that my patients wouldn't have angina at that point. Sometimes it even has beneficial effects upon blood pressure and other aspects in terms of what's going on. So then things like beta blockade and possibly ACE inhibitors can then be reviewed. But in the long run, because of the fact that by definition, patients that have had an angioplasty have coronary artery disease, they would be expected to take aspirin and a statin and maybe other secondary prevention medications such as beta blockade and ACE inhibitors indefinitely, but that would be very much at a personal level where we would clearly discuss that with each individual patient and decide what did or didn't need to be done.